Doctor, we are live.
Okay. So good evening, postgraduates, and my greetings to all the mentors who have logged in today for this first quarterfinals of the season 5 of Big Q. So this is a pan-India intercollegiate quiz which is being done by the gang of brain teasers, which is associated which we do in association with Ophthalmological Society of Nagpur, and and it is the Big Q. So this is the signature tune of our Big Q for last 5 seasons. Has been brilliantly it's just not learning, it's also fun. You feel as
बंद घड़ी की भी रुकी हुई सुई होती सही दो दफा चुप क्यों है रहना मन का तू कहना रोके चाहे हिचकियां खोल पर
So once more, good evening, friends, and my pranam to all the mentors. Brain Teaser team welcomes you to this very first quarterfinal of the 5th season of Big Q. Well, just for the people who have joined us for logged in for the first time, Brain Teaser is an online platform we created for hosting quizzes for ophthalmologists of our country since last 7 seasons. It was 4 or rather 5 years back, for the first time in our country, we initiated an exclusive quiz for postgraduates with the single aim of getting all the postgraduates from across the country on a single platform. There are approximately 320 plus institutions which are offering post graduations in ophthalmology, be it MS or DNB. Last 3 seasons, we have done it in association with Ophthalmological Society of Nagpur, and we are really thankful to the office bearers of Ophthalmological Society of Nagpur for associating with us. So here we are with the 5th season, and today, once more, let me take an opportunity to thank the President of Ophthalmological Society, Dr. Rahul Tiwari, for being a part of this particular venture of ours. Well, the 5th season had 6 preliminary rounds, and from that in which we had almost 280 plus teams which had participated. Now they have boiled down to 80 teams, each 84 teams. Each quarter final will be having 21 teams. Then they will move on to the next 2 semifinals, and there will be one final. These episodes would be all aired now. The quarterfinals are going to be aired on every Wednesday for next 4 Wednesdays at 7:30 p.m. Brain Teaser team is extremely thankful to the team of quiz masters who toil hard to create such a wonderful experience of learning with fun. In today's episode, we have some new quiz masters along with few of the veterans who have been associated with us in last few seasons. Dr. Tushar Grover, who is currently working as a medical director, Vision Eye Center, and visiting consultant at Sir Gangaram Hospital, Delhi, has been associated with us since last 3 seasons. The two new quiz masters for this season are Dr. Dipti Srivastav, who is an avid quiz master and is also an associate professor at Department of Ophthalmology, Goa Medical College. Welcome, ma'am. Dr. Aparna Nayak, who is a consultant cataract, cornea, and refractive surgeon at Prasad Netralaya, Udupi, Mangalore. Welcome, Dr. Aparna. Well, money maketh the mayor go is an old saying. Such a mega project is never possible without a strong financial backing from some industry, pharma industry. His Highness has been our partner since last 2 seasons, and my sincere most gratitude to Mr. Suryanarayanan, Mr. Naresh, Mr. Kaustubh for their support and helping us going ahead with this second season in a row. I would fail in my duties if I don't acknowledge the work done by the field force of His Highness team, who made so much of efforts to enroll all the postgraduates from across the country. Also, my thanks goes to Brain Teaser Platforms, which was created by Mr. Sai and his Numerotech team. And we are really thankful for all the back-end work and and they help us out in rolling out all the online quizzes without any glitches. And last but not the least, my own co-host, Dr. Shilpi Narnavre, who is an avid quiz master as well as a vitreoretinal surgeon with us. And she's the backbone for all this particular last 5 seasons. Thank you, Dr. Shilpi. Well, now I hand over the screen to Dr. Shilpi for familiarizing all the contestants with the rules of the game for the first quarterfinal. Over to you, Dr. Shilpi.
So, good evening, friends. Welcome back for this first episode of quarterfinals. So, there will be total 84 teams in 4 quarterfinals. So, 21 teams per quarterfinal will be playing. So, today is the first quarterfinal. Second quarterfinal will be on next Wednesday, that is 1st April at same time, 7:30 p.m. So, teams, you have to log in from two screens, that is Kahoot and Zoom platform. First screen is live quizzing, that is on Zoom platform. And out of the 2 rounds, one round will be face to face with the quiz masters. That will be the rapid fire round. And the second screen is for the Kahoot, that is for the MCQ round, which has to be played by both the audience and the teams. I request all the mentors to log in from separate screen only on the Zoom platform. So out of the 21 teams who are playing today's quarterfinal, 5 teams will qualify for the semifinals. And the criteria for qualifying for semifinals is your respective quarterfinal marks plus the best of 4 preliminary rounds will be calculated. Now coming to the rules, the format will be like previous. MCQs will have each set have 5 questions played by both the teams and the audience. There will be no negative marking and you will get 10 seconds time for this. Now the second round is the rapid fire round only for the teams. So you need to answer 5 questions in 30 seconds time. Correct response, for the correct response you will get plus 10. And for every incorrect answer, it will be minus 5. So if you don't know the answer and you say pass, so no marks will be credited. So teams who are not playing today's quarterfinal, they can log in and play as audience as in private practitioner category. So these are the prizes for the PGs in the finals, while audience prizes are per episode. So with this, I invite our first quizmaster, Dr. Tushar Grover, who is Medical Director at Vision Eye Center and Visiting Consultant at Sir Gangaram Hospital. He is a cornea, cataract and refractive surgeon. He did his post-graduation from Arvind Eye Hospital, Madurai and fellowship from Narayana Netralaya, Bangalore. He is a recipient of awards in various national and international conferences, including ASCRS, ESCRS, AIOS, and DOS. To his credit, there are various publications in journals including JRS, IGO, and DGO. He is reviewer for journals like IGO and AJO. He is section editor for Refractive Surgery DOS Times and coordinator for ISCRS Delhi chapter. And his special interest is keratoconus, refractive surgery, corneal transplant, cataract surgery, and dry eyes. So with this, I hand over the screen to Dr. Tushar sir. Welcome you, sir.
Thank you so much, Dr. Shilpi, and thank you so much to you and Prashant sir for having me. It's always been a pleasure being a part of this. So I'll start with the section 1 of my questions. So here we go. The first question in the first section is, you have the image of a 32-year-old patient who has a central corneal opacity following a healed microbial keratitis. The best corrected visual acuity with spectacles is 636. Which of the following contact lens options is the most appropriate to improve vision in this patient? And your options are A, soft hydrogel contact lens, B, silicone hydrogel contact lens, C, a rigid gas permeable contact lens, D, daily disposable soft contact lens. Your time starts now. So time's up. The answer is rigid gas permeable lens. So I hope most of you got it right. Let's move on to the next question. So this is a 64-year-old patient who's presenting with chronic bilateral conjunctivitis with progressive conjunctival scarring and recurrent sembliferon formation. The direct immunofluorescence of conjunctival biopsy shows linear deposits along the basement membrane. So it's obvious that this is a case of ocular cicatricial pemphigoid. But which of the following findings is most characteristic of this? Let's have the options. A. Granular IgA deposition in the conjunctival epithelium. Next option is B. Linear deposition of IgG and C3 along the epithelial basement membrane. C. Subepithelial fibrosis with predominant eosinophilic infiltration and negative immunofluorescence. Or D. Intraepithelial blister formation due to acantholysis. Your time starts now. All right, so time's up. The answer is B. Linear deposition of IgG and C3 along the epithelial basement membrane. So this is typical occipital pemphigoid. So let's move on to the next question. Can you want? Okay, I think is it my internet that's problematic here?
Yes, sir.
Yeah.
Net is
So
unstable.
okay, perfect. Sure.
Okay.
That's okay. I can see the slide now, so we can go ahead. So you see an image of a patient who underwent penetrating keratoplasty 1 year ago and has now presented with pain, redness, and blurring from the last 3 days. Which of the following is not appropriate management for this patient? Your options are A. Immediate corneal scraping for smear and culture. B. Increase frequency of topical steroids. C. Remove loose corneal sutures. D. Cyanoacrylate glue in case of corneal thinning. So which of the following is not appropriate management for this patient? Your time starts now. The time's up, and the correct answer is B, increased frequency of topical steroids. As you can see, there is infiltration, there's an epithelial defect. So all of the other are things that you would like to do except increase steroids. Let's move to the next question. So which OCT finding best correlates with the effective biomechanical treatment zone after doing epithelium of collagen cross-linking? Your options are A, subepithelial haze, B, stromal demarcation line, C, endothelial hyperreflectivity, D, posterior stromal edema. Your time starts now. So the correct answer is B, stromal demarcation line. This is the finding that best correlates with the effective treatment zone. Let's move on to the next question. So you see that image, and which of the following statements is true regarding the glue that is used in this patient? Your options are A, it is best suited for corneal perforations larger than 4 millimeters in diameter. B, it reduces risk of corneal perforation by forming a rigid barrier. C, it is completely biodegradable and does not induce corneal vascularization. D, cyanoacrylate glue should be avoided in active infectious keratitis due to risk of worsening infection. Your time starts now. the correct answer is, so cyanoacrylate glue reduces the risk of corneal perforation when you have extensive thinning by forming a rigid barrier. So your answer is B. Perfect. Let's move on. Okay, so that's all from my first section. I'd like to introduce the next quiz master, Dr. Aparna Nayak. She's a cataract, cornea, and refractive surgeon based in Udupi and Mangalore at Prasad Nitrale. She's done her MS ophthalmology from Government Medical College in Calicut. She's done a cornea and phaco-refractive fellowship from Sankara Eye Hospital in Guntur, and is involved in various academic and surgical training courses, has actively participated in instruction courses, debates, and webinars in various conferences, and has multiple publications in index journals. So welcome, Dr. Aparna.
Thank you for the kind introduction, Dr. Tushar. So, thank you, Dr. Shilpi and Dr. Prashant sir, for inviting me to this PG quiz. So, we'll be starting with the rapid fire round.
So in this, we will display the 5 questions simultaneously. The teams, you will get 30 seconds time and you can answer randomly, but you need to let us know which question number you are answering. And as you know, +10 for right answer and -5 for the wrong answer. Okay. So now the first team I invite is GMC Fovea Finders from GMC Nagpur. So please switch on your audios and videos.
Hello.
Hello, Team GMC.
Yes. Good evening, ma'am.
Good evening. Please introduce yourself.
I'm Dr. Darshita Pandey.
And I'm Dr. Richa Verma. We are from GMC Nagpur.
Okay. So, shall we start?
Yes,
Yes,
ma'am.
ma'am.
Ma'am, shall we start?
Yes, yes. So, coming to the questions, why was lens extraction avoided in earlier times? Which drug preparation is commonly used during anterior vitrectomy to visualize?
Intravitreal trampone.
Name the classical iron deposition line seen at the base of the cone in keratoconus.
Pleasure line.
In Begolini striated glass test, if a patient sees only one line, what does it indicate?
Suppression.
Background illumination in HFA.
Okay. So, time is up. So, they answered 3 questions. All were correct. So, they get +30. So, we'll see the answers now.
So the first answer is due to lack of anesthesia and antisepsis. So that's why the lens extraction was avoided in earlier times. And you've answered the second question right. You use a preservative-free triamcinolone. And classical iron deposition, that's hemosiderin deposition, is seen in the cone of keratoconus. That's the Fleischer's ring seen in cobalt blue filter. And in Begolini striated glass test, if patient sees only one line, it indicates suppression. And it's 31.5 apostolyps in compressed field analyzer. So I think you have guessed 3 right, so it's +30.
Thank you.
Thank you, ma'am.
Thank you. So the next team is Optic Warriors from AIMS Raipur.
Hello, good evening, ma'am.
Good evening.
Good evening.
Please introduce yourself.
Ma'am, I'm Dr. Priyanshi Pandey. Good evening, ma'am. I'm Dr. Bhavna. We are from AIMS Raipur.
Okay, well. So let us begin with the set of questions for you. Which instrument revolutionized retinal examination in the 19th century?
First, indirect ophthalmoscope.
Teprotumumab is a monoclonal antibody used in the treatment of which ocular condition? Teprotumumab. Which corneal topography system uses a rotating Scheimpflug camera?
Schlemfling. Angle alpha is the angle between pupillary axis and the optical axis.
Which cells are primarily damaged in glaucoma? Rods,
Ganglion
spokes,
cells.
So, ma'am, what about the first answer? Shall we
They
give?
have told indirect of
Yes.
scope.
That's
So
so What's
So
your
it-
take?
maybe we can give them half if that is there.
Okay, plus 5 we will give them.
Yeah.
And plus 10 for the fourth answer.
Yes.
And what ganglion cells they said
Yeah, they've
about.
answered the fifth.
Yes. Okay, so plus 25 for.
Yes. So yeah, it was by von Helmholtz. That's ophthalmoscope that has revolutionized the retinal examination in 19th century. And this monoclonal antibody is used in thyroid eye disease. It's a insulin-like growth factor antagonist. It's a monoclonal antibody. And Pentacam uses the rotating Scheimpflug camera principle. And you've answered the angle alpha right. It's between the optical and the visual axis. And retinal ganglion cells are the ones damaged in glaucoma.
So the next team is Team Griffinder from AIMS Bhubaneswar. Team from AIMS Bhubaneswar.
Hello.
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 Can you
Yeah.
can you please introduce yourself?
Audible. Can you
Hello.
can you introduce yourself, please?
Yeah, I'm Dr. Shreyas from AIMS Bhubaneswar.
Hello, I'm Dr. Sanstita from AIMS Bhubaneswar.
Okay.
So are you ready?
Yes.
Be louder, please.
Yes.
In experimental studies, what is the rate of corneal swelling rate when corneas were perfused in distilled water?
Pass.
What's the mechanism of action of olopatadine?
H1
Dual
antagonist.
mast cell stabilizer plus antihistamine.
In Worth 4 dot test, if a patient perceives 5 lights, 2 red and 3 green, what does it indicate? Which tonometer is
Fusion.
considered the gold standard for IOP measurement?
Goldman applanation tonometer.
Clinical signs causing nasal corneal shadow in oblique illumination.
Risuti sign.
What about the third one?
Last question.
Pass.
Fusion insufficiency.
Not audible.
They said fusion insufficiency.
Okay. Okay. So first one you've not answered. The rate of corneal swelling rate when corneas were perfused in distilled water is 40 to 50 microns. Mechanism of action of olopatadine was answered correctly. And yeah, the third one is wrong. The answer is diplopia when you see 2 red and 3 green in Worth 4 dot test. And fourth one, it wasn't audible.
They said Goldman applanation.
Okay, right.
Yes.
And fifth one, the time was up, but they have answered it right.
So we'll give them. Not an issue.
Yes, definitely. The questions were long, so yeah.
Yes, ma'am. Yes, ma'am. Okay. So the next team is Team RIO Trivandrum from RIO Trivandrum. Team RIO,
Yes, madam.
please introduce yourself.
Can you see us?
Yes.
Okay. I'm Dr. Deepthi. I'm Dr. Anju. We are final year residents from RIO Trivandrum.
Welcome.
Okay. Shall we start?
Yeah.
Okay, madam.
So, what is the average anterior posterior diameter of the crystalline lens?
Pass.
Deficiency of which vitamin can cause ophthalmoplegia along with ataxia and confusion?
Pass.
What accelerated CXL law equates intensity and exposure time? Cross-linking, corneal collagen cross-linking. Anatomically, which part of the iris is the thinnest? Which structure is identified by the corneal wedge technique on gonioscopy?
Shall we say?
So the average AP diameter of the lens is 3.5 to 5 mm. And the second answer for second question is Wernicke's encephalopathy due to thiamine deficiency. And accelerated cross-linking law, it uses the Bunsen-Roscoe's law. And The part of the iris that is the thinnest is the root. That's why in trauma you have the iridodialysis where the root is detached. And then the structure identified by the corneal wedge technique, you've answered it correct, the Schwalbe's line.
So plus 10, rest they didn't answer.
Yeah.
So the next team is Team Smart from Ranchi. Are you there?
Hello.
Team Smart.
Yes, ma'am.
Okay, please introduce yourself.
Myself, Dr. Mugdha.
And myself, Dr. Rashmi, 30-year resident from Rio Ranchi.
So shall we start?
Yes, ma'am.
Yes, ma'am.
Be louder, please.
How many anterior ciliary arteries exist? What is the ocular adverse effect of chloroquine? Embryologically speaking, the first evidence of eye formation starts around which week of gestation? Angle of mirrors in 4-mirror gonioscope. What
Sir, ma'am, answer four is 64 degrees.
What stromal demarcation line depth indicates the effectiveness of cross-linking using the Western protocol? You can answer this. Last.
Ma'am, first answer is answer. Not sure. Not
First
sure.
answer is?
Not sure, ma'am.
Okay. So time is up. You have answered only one. So that is 4.
Fourth one. So the first answer is 7. So 2 for each rectus muscles, and lateral rectus has only 1. And the adverse effect of chloroquine is bullseye maculopathy. You have to do a retinal examination when the patient is on chloroquine. And answer for the third question is 3rd week as the first evidence of eye formation during gestation. And you've answered the 4th question, okay, 62, 64 degrees, it's fine. And the 5th one is 300 microns. So that is the demarcation line which shows the effectiveness of your cross-linking procedure. So I'll be introducing you to the next quiz master. So we have Dr. Deepti Srivastava. So she's an associate professor in Department of Ophthalmology, Goa Medical College. And she's a member of the Medical Education Cell and the Institutional Ethics Committee. And her areas of interest are in surgical teaching and low vision rehabilitation. And she's also a gold medalist in ophthalmology and a young ophthalmic teachers. She's won the Young Ophthalmic Teachers of India Award in 2024. Welcome you, Dr. Deep.
Thank you so much, Dr. Aparna, and thank you, Dr. Shilpi and Dr. Prashant, for this wonderful opportunity to be at this platform. Wishing all participants all the very best.
Shall we start, ma'am?
Yes.
So the next team is Team Optic Ninjas from Prasad Netralaya. Are you there?
Yes, ma'am.
Okay.
Good evening, everyone. I'm Dr. Krina.
I'm Dr. Prem.
We are from Prasad Netralaya.
Okay. So, shall we start?
Yes, Dr. Shilpi.
Okay.
So here are your questions. For confrontation method, distance between examiner and the patient.
1 meter.
For the lens capsule, 14 microns is which part of the lens capsule thickness?
Next question.
Which corneal stromal dystrophy will have amyloid deposits? You have to be louder. What is the refractive index of aqueous humor?
1.41.
Which histological variant of choroidal melanoma?
Second one is anterior, ma'am.
Okay. And the last one, because the question had begun, so you're allowed to answer it. Which histological variant of choroidal melanoma has highest risk of METs?
I'm not sure.
Not sure.
All right. Ma'am, can we have the answers and the scores? So 1, they have answered correctly. I heard it.
Yes, ma'am.
Second also we answered.
Second question is answered.
Yes.
And the third question was not answered.
Yes, ma'am.
Not answered.
Fourth question was answered incorrectly, 1.4.
Yes.
And fifth question was not answered.
Yes.
So yes, you're right. 1 meter is the distance, and absolutely correct. It is the anterior lens capsule. Lattice dystrophy is the dystrophy which shows amyloid deposits, and it's typically bilateral, starts usually in childhood. And what is important to remember is that these people are going to have a gradual loss of central vision. They also have recurrent epithelial erosions. And the type 2 one is the one which is also associated with systemic amyloidosis. It's called Meritoja syndrome. Aqueous humor, you must remember, is 1.33, just slightly less than cornea, 1.37, slightly less, okay? And it's the epithelioid variant, which is, the worst or the highest risk of METs is with the epithelioid variant. Thank you.
Thank you.
So you get plus 15. The next team is Team Binocular Bandits from KMC Mangalore.
We are looking forward to the team introducing themselves.
Good evening, ma'am. I am Dr. Prerna Ahuja.
Good evening, ma'am. I'm Dr. Raghuveer.
All
We
the
are from
best.
KMC Mangalore, ma'am. Thank you, ma'am.
So shall we start?
Yes, ma'am.
Okay. So
So
yeah,
here are your questions. Average thickness of posterior lens capsule, posterior pole.
Pass, ma'am.
In the EVS study, most common bacterial cause found.
Staphylococcus, ma'am.
Most common corneal dystrophy causing recurrent corneal erosions.
Pass, ma'am.
Applanation tonometry, which law?
Imbert-Fix law.
Modified Imbert-Fix principle, ma'am.
Bullseye maculopathy, which drug are you going to associate it with?
HCQ.
Chloroquine, hydroxychloroquine.
All right. So posterior lens capsule, it is about 3.5 to 4 microns, okay? Really, really thin. That is why you have PCRs, right? And that is why you can do NDR capsulotomy so easily because it's really, really thin. In the EVS study, you said staff, so fine, it can be given. If you really want to be very technically correct, then it is the coagulase.
Epidermidis. Yes, ma'am.
Okay, and you can imagine like 70% of the cases, it is this organism associated. Most common corneal dystrophy, it is the epithelial basement membrane, okay, or the map dot fingerprint dystrophy. Applanation tonometry, you've correctly answered. Imbert-Fick or modified Imbert-Fick. Do you know the diameter of applanation? 3.06.
3.06.
And you have correctly answered the drugs for bullseye maculopathy. Thank you.
Thank you, ma'am.
so plus 30 for this team. So the next team in line is Wizards of Eyesight, the Eye Foundation, Coimbatore. Have you logged in? Team Wizards of Eyesight? Okay, let's move on to the next team. Next team is Team Lumina from Chaitanya Eye Hospital, Kerala. Team Lumina?
Yes, ma'am.
Yes. So
I'm Dr. Shehana,
Hmm.
final year resident from Chaitanya Institute, Trivandrum. And I'm Dr. Parvati, final year resident, Chaitanya Institute.
All the best.
So shall we start?
Thank you, ma'am. Yes, ma'am.
Be closer to the mic and be louder, please. Huh?
Questions for you. Average visual acuity at birth.
3/60.
In the EVS study, when you have to intervene, you have to do a vitrectomy. What is going to be your criterion?
Pass.
The crystalline lens is located in which depression? What's the name of the depression in the vitreous, between the iris and the vitreous?
Patellar fossa.
What is the
Patellar
mixed
fossa.
implant made of gelatin?
Pass. Fuchs. Fuchs.
So the time. Okay. Ma'am, what about the second answer? I couldn't hear that.
Actually, they passed it.
Okay.
They took some time to pass it. So this is an important pointer for all the teams that if you don't know or you are hesitating, then you can just pass so we can go through all of the other questions in the given time. So yes, 3/60 they answered correctly. It is visual acuity which is the criterion. So when the visual acuity is hand movements and better, you will give intravitreal antibiotics. And when it is reduced to perception of light, it is an indication for vitrectomy. Patella fossa was correctly answered by them. It is the Zen gel stent, which is actually derived from porcine collagen. And this is a kind of MIGS implant, minimally invasive glaucoma surgery implant. And well, there was no time to actually like say the question, but they have answered Fuchs.
Okay. So they also get plus 30. So the next team in line is Team GBMC from Bundelkhand Medical College, Sagar. Are you there?
Yes, ma'am.
Okay.
Hi, team. Are you ready?
Yes, ma'am.
Please introduce yourself.
Ma'am, I'm Dr. Ayushi Modi. I'm Dr. Shivani from Bundelkhand Medical College, Sagar.
Okay. So shall we start?
Yes, ma'am.
Okay. All the best.
So your questions? Remnant of posterior hyaloid artery to lens. What is it called?
TVL.
Next.
Pass.
For the if the corneal cylinder is 2 diopters, toric IOL will have cylinder more than 2, less than 2.
More than 2.
Corneal involvement in severe VKC. What is it called?
Ma'am, it's shield ulcers.
Which extraocular muscle does not come from the apex? And what is the
Inferior
typical
oblique.
wavelength used in SLT?
Inferior oblique.
Typical wavelength used in SLT. Since we
532
couldn't fit in the
nanometer.
question.
Great.
Okay. So remnant of the posterior hyaloid artery, it's called the Mittendorf dot. That was not answered by you. You're correct. More than 2 diopters of toric. Severe VKC shield. Inferior oblique, as you rightly said, does not come from the orbital apex. It comes from the anterior orbit. And typical wavelength, you have correctly answered, is 532 nanometers.
Okay. So plus 40 to them.
Yes.
So the next team is Team Eyesight from Jipmer, Pondicherry.
Hello, Team Chipma. Are you there?
Okay. Let's move on to the next team. Team Pupil Powers from AIMS, Gorakhpur.
Good evening, ma'am.
Good evening.
I'm unable to on my video.
Please introduce yourself.
I'm Dr. Shagun from AIMS Gorakhpur.
Ma'am, I'm Dr. Nivedita from AIMS Gorakhpur.
Shall we
All
start?
right. Before we start, again, a reminder to the teams, as Dr. Shilpi said, to please be loud.
Yes,
Okay?
ma'am. Okay, ma'am. Okay, ma'am.
If you're hesitating, so that we can finish the questions.
Okay, ma'am.
All the best. Which systemic disease is associated with
Myotonic
Christmas?
dystrophy, ma'am.
Every 3-degree rotation of toric, how much toricity would be lost?
Pass.
KF ring in Wilson's. Which layer of cornea will you find?
Decimex.
Which extraocular muscle is shortest?
MR.
Which lasers commonly used for transscleral cyclophotocoagulation?
India.
You want
So
to
let's
pass?
see
Want to answer? Team.
Pass, ma'am.
Last question. Pass. Okay.
Which laser?
No, they actually answered it wrong. They said NDA. They said NDAG.
Yes.
Diode. That's what.
Yeah. So Christmas tree cataracts correctly answered myotonic dystrophy. Every 3 degree of rotation was passed by you. The loss of toricity is 10%. So you can imagine if the toric lens rotates by 30 degrees, then actually it's like absolutely no use of, of putting in that toric lens. So there is loss of toricity, 10% for 3 degrees. KF ring correctly answered decimates. Extraocular muscle having shortest course, you said MR. It is actually the inferior oblique, which is the shortest one. It doesn't come from the apex, no, it comes from the anterior orbit.
Yes.
And laser used for transscleral cyclophotocoagulation is the diode laser, okay, which is in the near red spectrum, 810 nanometers.
Okay, ma'am.
So 2 correct, 2 wrong, and 1 pass. So it totals to plus 10. So we are over with the 10 teams. Now it's time for a short commercial break. We thank the His Highness team for the constant support. So teams, again, it's a reminder that next quarterfinal will be on the subsequent Wednesday, that is on 1st of April at same time with new quiz masters. So do log in. Even if you are not playing the quarterfinals, you can just refresh your knowledge, you can take part, and even if you want, you can take part as a private practitioner. So now again, I welcome Dr. Tushar for the second set of MCQs.
Thank you so much, Dr. Shilpi. Let's start. So the first question for this round is, which clinical or investigative finding best helps differentiate pellucid marginal degeneration from inferior keratoconus? Your options are A, the age at presentation, B, central corneal thickness, C, the location of maximal thinning, or D, presence of scissoring reflex. Your time starts now. So the correct answer here is C, the location of maximal thinning is what differentiates PMD from inferior keratoconus. Let's move on to the next question. So the second question is, which of the following procedures is least appropriate for this patient? I hope everybody is able to appreciate this tomography. Okay, so let's have the options. A, surface ablation. B, ICL. C, keratolenticule extraction. Or D, PRK extra. Your time starts now. So the correct answer here is C, keratolenticule extraction, because if you look in the pachymetry map, you can see that the pachymetry is quite low. It's about 470 or so. In these cases, you would not want to do a keratolenticule extraction or a LASIK. All the other options are possible. So let's move on to the next question. So this individual complains of frequent episodes of severe pain and foreign body sensation, especially in the morning when waking up from sleep. Which pathological abnormality is most directly responsible for this condition? Your options are A, increased epithelial turnover, B, defective epithelial basement membrane adhesion, C, endothelial pump failure, D, reduced corneal nerve density. Your time starts now. So the correct answer is B, defective epithelial basement membrane adhesion. As you can see from the image also, and very typical in the history, this is recurrent corneal erosions, and waking up from sleep with pain along with the clinical picture is suggestive of that. Let's move on to the next question. Which post-operative finding most reliably indicates irreversible endothelial graft failure after penetrating keratoplasty? Your options are A, early stromal edema, B, Descemet folds, C, persistent graft edema beyond 3 months, D, acute endothelial rejection line. Your time starts now. So the correct answer is C, persistent graft edema beyond 3 months. So this is what indicates irreversible failure. All the others can also be present in a case of acute rejection, which can potentially be reversible. So let's move to the next question. The fifth question is, which factor most influences post-operative effective lens position and refractive outcome after cataract surgery? Your options are A, IOL material, B, preoperative axial length, C, the incision size, or D, the IOL optic design. So your time starts now. And the answer is B, preoperative axial length. So this is what primarily in terms of determining the effective lens position is the most important out of all of these factors. So I hope most of you got these questions right, because I think they're reasonably easy. So let's have Dr. Aparna Nayak again with the rapid fire round.
Aparna ma'am?
Yeah.
Yes. So, team eyesight, is your problem resolved?
Can you see us, ma'am, now?
Yes, we can hear you.
Yeah.
Okay. So, please introduce yourself.
Myself, Dr. Vinith, I'm second resident in Jigmar.
I'm Dr. Dania, secondary resident from Japan.
Okay. Good. So, shall we start?
Yes.
Okay.
Which method or test tests the tear reflex secretion?
Sharma's
What is the percentage of atropine used in myopia progression?
0.01%.
Bilateral course SPK mimicking adenoviral SPK that worsens with topical steroid.
Plus,
In iris, which layer is responsible for the definitive color
Chroma.
of the iris? What does PSD represent in
Focal
visual
RNFL loss.
PSD, expand PSD.
Pattern standard deviation.
Okay. And what about the fourth answer you said?
Pigment layer. Pigment.
Okay.
Yeah, you have just told Shermer's. It's Shermer's test 2 with manual stimulation of nasal mucosa. That's when you test the reflex secretion. The percentage of atropine, you have got it right. It's 0.01%. And the third one you haven't answered. So whenever a SPK worsens with steroids, when it's a microsporidial keratitis, and the iris layer responsible for the pigmentation is the anterior limiting layer. And PSD, you have got it right. Pattern standard deviation in HM.
So, ma'am, what about the first one?
I think we can give them, no problem.
Okay. And fourth, you want, I mean, they said pigment layer.
No.
No. So, whether it is negative or no marks?
Negative, because they've answered something, right?
Oh,
so
okay.
Yeah.
So 3 correct, 1 wrong. So that comes totals to be 25. Okay. So the next team is Team RIO A6 from RIO Kolkata.
Is the team online?
Team RIO A6.
Good evening, ma'am.
Good evening.
I'm Dr. Shantoni Mondol.
I'm Dr. Tanvir Ahmad.
We are from RI Kolkata.
Okay, all the best. Corneal innervation density compared to skin is? What is the standard dosage of intravitreal ceftazidime?
0.01 mg per ml.
Rapid in vivo diagnostic tool for fungal filaments?
KOH mount.
Which OCT parameter correlates best with functional loss in glaucoma?
RNFL.
Convergence paralysis associated with vertical gaze paralysis is seen in which syndrome? You can answer this.
Second one is 2.25 mg.
But the first time I think you said something else.
0.1 ml per.
Okay.
Okay, let's see the answers. So the first one is it's 300 to 600 times higher than that of skin, the corneal innervation, and the standard dosage is 2.25 per 0.1 ml. So initially, I think you are told something else, but later on you have told the right answer. And a rapid in vivo diagnostic tool would be a confocal microscopy. And OCT parameter that correlates best with the functional loss you've already answered is the RNFL thickness. And the last answer is a Perinod syndrome. It's also called as a dorsal midbrain syndrome. So the second one, I'm not sure. Dr. Shilpi, like what would you suggest? Because initially they told something else, but in the end they told the right answer.
Okay, so it's not accepted. What we can do is we can just give them, okay, not even the negative, but 0.
Yeah, that's.
And third, I think they didn't answer, na ma'am?
No, they didn't answer that.
Okay, so it's plus 10 to them. So the next team is Team Warriors from RIO Guwahati. Team Warriors, RIO Guwahati, have you joined? Okay. Team Wizards of Eyesight, Eye Foundation Coimbatore.
Yes, ma'am. Can you hear me, ma'am?
Yes.
Yes,
Please
ma'am.
introduce yourself.
Yes, ma'am. I'm Dr. Bhumika Nisar, and my other partner actually she's in an outposting, so she can't be present right now. We are from the Eye Foundation Coimbatore.
Okay, not an issue. So shall we start?
Yes, all the best.
Thank you, ma'am.
After an ECC wound, new collagen starts forming and completely covers the wound length between duration.
Next one, ma'am.
Which injectable drug can be used to treat crocodile tears due to aberrant regeneration of seventh nerve?
Pass.
Preferred needle size for corneal intrastromal voriconazole.
Pass, ma'am.
Beneath which retinal layer are the deposits?
Second one, botulinum.
Found? Yes.
Second, botulinum.
Okay.
Which group of anti-glaucoma drugs is contraindicated in patients with asthma?
Beta blockers.
Okay. And what about the fourth one?
Fourth one, ma'am, RP and Brooks.
Okay.
So the first one is the new collagen starts forming and completely covers the wound between 5th to 11th day of surgery, that is 1 to 2 weeks. And second one, yeah, you've answered it right. The injectable drug to treat this is a botulinum toxin. And the preferred needle size is a 30 gauge needle for intrastromal voriconazole. And the fourth one is the Brooks membrane. And the fifth one, the group of anti-glaucoma medication contraindicated in asthma is beta blockers. You got that.
Okay. So plus 30 to this team. So the next team is Team Ames Warrior from Ames Patna. Team Ames Warrior. Okay. Next team is Team GMC from Bhopal.
Hello.
Acha, Ames Warrior, you are there?
Yes, ma'am. Good evening, ma'am.
Okay, good evening. So, please introduce yourself.
I am Dr. Shalu, ma'am. And I'm Dr. Tarita. We are from Ames Patna.
Okay.
All the best.
Okay. So, shall we start?
Yes, ma'am.
Okay. We can't hear you. Be closer to the mic and.
Yes, ma'am. Yes, ma'am.
What is the mean intraocular pressure in newborns?
Pass.
Nerve supply of sphincter pupillae muscle.
Pass.
25-year-old man with bilateral lens subluxation and BRVO advised to take a low methionine diet and is given pyridoxine.
Homocystinuria.
Most common cause of corneal pseudodendrite without terminal bulbs.
Herpes zoster.
Which drug class decreases the aqueous production and increases
Prostaglandin.
First
One,
10
to 12 mmHg.
what? Please.
10 to 12.
10 mmHg, 10 to 12. Okay, the last one.
Prostaglandin analogs.
All right. Okay. So yeah, so this is your answer. The IOP in newborns is 10 to 14 millimeter of mercury. And the nerve supply of sphincter pupillae is parasympathetic fibers through the third cranial nerve. And third one, you got it right. It's homocystinuria. So it's very important that you evaluate a young patient with the early VRVO, and there will be lens subluxation, that is inferior and nasal. And the fourth one, the most common cause of pseudodendritis is a herpes zoster ophthalmicus. You got it right. And the fifth one is adrenergic agonist, alpha-2 adrenergic agonist, not prostaglandin analogs.
So 3 correct, 1 pass and 1 wrong. It totals to plus 25.
Thank you, ma'am.
Okay, welcome. So the next team is Team GMC from Bhopal. Are you there?
Yes, ma'am.
Okay,
Good
please
evening, ma'am.
introduce yourself. Good evening.
Dr. Alpna. Sorry, my colleague is sick today.
Okay. So shall we start?
Yes, ma'am.
Be louder, please.
Yes, ma'am.
What is the diameter of the plunger in tonopen?
Pass.
In which condition will you see a green sunflower cataract?
Pass.
Layer involved in acute corneal hydrops in keratoconus.
Stroma, descent membrane.
Answer 1. Total number of
Descent membrane.
anterior ciliary vessels.
2.
Topical antiglaucoma group of drugs increase iris pigmentation.
Prostaglandin.
Okay. So the first answer is 1 millimeter. The plunger is 1 millimeter in diameter of the tonopen. So you have the silicone tip, which you have to replace it. And the second answer is the Wilson's disease, the typical sunflower cataract. And third one is Decime's membrane. So initially you said stroma and Decime's.
Then later on, ma'am, they said this.
Right. Fourth one is 7. I think you mentioned 2.
Yes.
That's wrong. So fifth one is a PG analog. That's irreversible once there is iris pigmentation.
So plus 15 to this team. Okay. So with this, we end with the 15 teams. Now I invite Dr. Deepti ma'am again.
Over to you, Dr. Deepti.
Yeah, thank you, Dr. Aparna. Thank you, Dr. Shilpi.
So the next team is Team SGN from Shri Ganpati Netralaya. Team SGN.
Hello, Team SGN. Are you there?
Okay. Team iVengers from Shri Ganpati Netralaya. Team Insight Optics from Arvind. Team Orostars 3. Any of the team which is left, please let us know. Team SGN, Team iVengers, Team Insight Optics, Team Orostars, Team Warriors.
Team SGN.
Team SGN.
SGN had 2 teams, no? So this is the iVengers or the Team SGN?
Ma'am, I don't know. 2 teams are there. One with the name of SGN and one from the Warrior. This
iVengers. This is which team now logging in?
Some audio. Sai, can you help them out?
Which one, doctor?
Which
Team SGN.
team SGN? Okay. Can you, okay, if you are unable to even switch on the video, can you hear us?
Ma'am, can you see us?
Yes. Dr. Shruti.
Yes, ma'am.
Okay.
Ma'am, Dr. Shruti and
Dr. Sonali from Arvind Eye Hospital,
Coimbatore.
Arvind, which team, beta?
Oro Stars 3.
Oro Stars 3. So from next time, just mention your team name. Okay?
Yes, yes, ma'am.
So, okay, we'll start with team Oro Stars 3.
All the best, Oro Stars.
Thank you, ma'am.
Radial extension of rexis in intumescent cataract. What do you call it?
Pass.
If there is silicon oil in the posterior segment and you don't adjust it during your biometry, what would be the post-op refractive error?
Hypermetropia shift.
In dextro elevation, for right superior rectus, what is the yoke muscle?
Left
inferior oblique.
Inferior oblique.
Co-pupillary dilatation in pseudoexfoliation, most common cause.
Pass.
We actually have run out of time, but we have made this concession for other teams. Therefore, for you, look at the picture there. There is a pterygium head. Iron deposition line. What is it called?
And what is it called? Chalkers line.
Chalkers line.
All right. Yes, over to you, Dr. Shilpi.
Yes, ma'am. Ma'am answers.
Yes. So, radial extension of rexis in intumescent, Argentinian flag. You were correct when you answered hyperopia. That would be the error if you don't adjust for silicon oil, because sound really slows down markedly in silicon oil compared to vitreous. In vitreous, it will be about 1532 meters per second. In silicon oil, it will slow down to as much as, 1000 meters per second. So you will get a, wrongly high axial length. If you don't correct it, then there'll be hyperopia.
Yes.
You are absolutely correct. Left inferior oblique is the yoke muscle. It will follow Herring's law. Most common cause of pupillary dilatation is iris sphincter degeneration or muscle degeneration and fibrosis, and not posterior synechiae, which is the cause, for example, in uveitis and poor pupillary dilatation. And iron deposition at pterygium head is the Stocker's line indeed.
Okay. Ma'am, few teams are unable to basically switch on their audio and video. So, what we can do is I can just make a call. They can answer on the mobile. That's what we can do.
Yes, surely. I think it will be always audible to everybody. The call.
I'll put it on the speaker.
Yes, perfect. Yes. The scoring for this team, if you
yes,
can
ma'am.
have.
Sorry. This is plus 30.
Yes.
I know it's taking a little more time. So we'll start with the team SGN. So, Tushar, phone number. हेलो हाँ क्वेश्चंस दिख रहे हैं ना आपको यू कैन सी द क्वेश्चंस ना क्वेश्चन स्क्रीन पे दिख रहे हैं आपको अरे नहीं कैन यू सी द स्क्रीन हाँ सो विल स्टार्ट यू कैन आंसर ऑन द मोबाइल ओके ओके so ma'am shall we start
Yes, Dr. Shilpi.
Okay. So we are starting Prajakta, okay?
Yeah. So here are your questions, Team SGN. What type of cataract you're going to see? Weddell cells, which are swollen bladder-like cells.
Okay, ma'am, they have said pass.
Which is for when you want to do chopping in phaco, you'll use burst mode or pulse mode?
Pulse mode.
What is the
Okay,
logmar equivalent of 20 by 20 in Snellens?
0.
Treatment of choice in medium-sized choroidal melanoma.
Pass.
And because it's a slightly unusual mode now where you're connected on phone, we'll give you the last question. See the picture, see the image there. That is a trabeculectomy bleb. At the edge is a pigmented line. What would such a line be named?
Okay, so time is up.
Yes. So let's see the answers. Weddell cells are seen in posterior subcapsular cataract. Basically, if you want to do chopping, you will prefer burst mode because it will have much better control and less chatter. A logmar equivalent, you are correct, it is 0. And logmar is really important because it's a linear scale and very useful in research. So 2020 equates to 0. And for medium-sized choroidal melanoma, it's brachytherapy, which is a treatment of choice. And indeed, very important because it can save the eye. You don't have to enucleate if you do brachy and it correctly and it works. And this line, the pigmented line at the trabeculectomy bleb edge, it's called the Ferry's line. And it is important because it signifies that there is aqueous flow. So these are the answers.
Okay, ma'am. So any other team? Team Insight Optics?
Hello, ma'am.
Hello, ma'am.
Yes. So
Yes,
for the
ma'am, before we go to Insight Optics, for
Yes.
SGN, the scoring.
+5, ma'am. One wrong because they answered it as the pulse mode, the second answer.
Correct. So their
And
answer
one
to
correct.
question number 3 was correct, 0.
Yes. So +5 to them.
Correct.
So the next team is Team Insight Optics from Arvind Eye Hospital, Coimbatore.
Yes, ma'am. Hello, ma'am.
Please
Hello,
introduce
team.
the-
Yes.
Hello, ma'am. I'm Dr. Vimi.
I'm Dr. Krishna ma'am.
We are from Aravind Eye Hospital, Coimbatore.
All the best.
Thank you, ma'am.
So your questions? Earliest cataract surgery and either eye treatment surgeries. Which ancient civilization is credited with it?
Pass.
Alpha 1 A adrenergic antagonist, most important ocular adverse effect.
Yeah. Allergic reaction.
For SLET, where do you get the donor tissue from? Simple limbal epithelial transplantation. Pseudoisotropia.
Same persons or allergic persons?
Okay. Pseudoisotropia, which type of angle kappa?
Positive.
Composition of pseudoexfoliation material.
Pass.
Okay. So let's see the answers.
All right, team. So it is ancient India. Sushrut was, in fact, there are images and records of Sushrut having carried out couching. So it is India, ancient India. It is, I'm sure you knew this, but it just must have slipped you. It is IFIS, intraoperative floppy iris syndrome, right? Which is very much associated with these group of drugs. Most common drug being tamsulosin, used for benign enlargement of prostate, isn't it? Contralateral healthy eye is the donor for SLET. And because you're going to take very little amount, so it's the person's other healthy eye, which is generally the donor, if it's a unilateral case. And remember, pseudoisotropia, it's a negative angle kappa. All right, angle kappa being what? The angle between visual axis and pupillary axis. Okay, so you'll see a negative angle kappa in myopia. You'll see it in, people who have broad nasal bridge. The reflex will be a little nasal. Okay, so negative angle kappa, pseudoisotropia. And pseudoexfoliation material, basically it is abnormal fibrillar extracellular matrix, which gets deposited everywhere. And the most relevant thing for us as ophthalmologists, I mean, especially when we are operating, is zonular weakness, which can happen because of this material on zonules. Okay. So Dr. Shilpi, if we can have the score.
Yes, ma'am. They answered 3 questions. Out of these 3, 2 were wrong and 1 correct. So it totals to 0.
Oh.
Okay.
But
So,
well played, yes.
The last team, again, they will be on phone only. So it's Team Eye Vengers from Shri Ganpati Netralaya.
Are they able to connect with us on phone, madam?
Yes, ma'am. Yes, ma'am.
I think, however, I am not able to hear them. So perhaps if the word pass I hear, or, if they've answered like the next, then I'll go on to the next question.
Okay, ma'am. Okay.
Because it's a little difficult to get the audio from the phone. I'm not able to hear.
Ma'am, let's try. Okay, ma'am. Okay. So, team, shall we start?
Yes, ma'am.
Okay. So you can see the questions, right?
Yes, ma'am.
Okay, so we are
All
starting
right.
now.
All the best. Full form of PMMA.
Polycrylate.
Polymethyl
methacrylate.
Great. Next.
Okay. Short stature, brachydactyly, spherophakia. Which inherited condition are you going to suspect?
Next.
Most serious side effects of topical NSAID. Nepafenac, Fleur.
Next.
When you do the Hochberg corneal reflex test, 1 millimeter deviation corresponds to how many degrees of squint?
2 degrees.
Next.
Which when you see neovascular vessels, where are you going to see them first appear in neovascular glaucoma?
Pupillary margin.
Okay. Great.
Right. So let's have the answer. PMMA correctly answered polymethyl methacrylate. Wheel-Marchesani correctly answered. Along in Wheel-Marchesani, there's a very high risk of angle closure glaucoma because of the spherophakia, the lens which can dislocate anteriorly. Most common side effect we all must remember is a corneal melt. So you're not going to use it in compromised corneas, NSAIDs. In Hirschberg's reflex, it is 7 degrees. 1 millimeter corresponds to 7 degrees. And you are correct in answering that pupillary margin is where the neovascular vessels first appear.
So, ma'am, they answered 4 questions, 3 correct, 1 wrong. So, plus 25 to them.
Yes, ma'am.
Any other team remaining? If yes, please let us know now because 2 teams have not joined.
Let's move on.
So let's now move on to the MCQ round again. So for a while, I'm just stop sharing the screen. I request Tushar sir to please just
Sure. Thank you, Dr. Shilpi. So let's move on to section 3 with the MCQs. So let's have the first question. So what you see here is an eye trace measurement. So which eye trace measurement most accurately separates the optical aberrations caused by the cornea from those caused by the internal optics of the eye? Your options are A, total wavefront, B, the corneal topography, C, internal wavefront, or D, point spread function. Your time starts now. So the answer is C, the internal wavefront. Let's move on to the next question. The next question is, which topographic or tomographic finding is most sensitive for detecting early keratoconus? And this can be with any topographer or tomographer. Your options are A, steep keratometry, B, inferior superior asymmetry, C, central corneal thinning, D, Vogt striae. Your time starts now. And the answer is B, inferior superior asymmetry. So this is something you can detect even with, say, Placido topographers, whereas for elevation, etc., you would need tomographers. Let's move on to the next question. The next question is, the holiday equivalent keratometry reading or the EKR map on Pentacam is primarily used to, the options are A, measure posterior corneal elevation, B, assess corneal curvature after refractive surgery, C, detect corneal scarring, or D, calculate corneal thickness. Your time starts now. And the answer is B, assess corneal curvature after refractive surgery. So as we know, with any corneal refractive surgery, our anterior to posterior corneal curvature ratio is altered, which is why you need to measure the anterior as well as the posterior keratometry. So this map is able to take that into account. Let's move on to the next question. The next question is, a 55-year-old patient presents with foreign body sensation, burning, and intermittent blurred vision. Examination shows conjunctival hyperemia, punctate corneal staining, and a tear meniscus height of 0.1 millimeters, which is the most likely diagnosis. Your options are A, meibomian gland dysfunction, B, aqueous deficient dry eye, C, allergic conjunctivitis, or D, exposure keratopathy. Your time starts now. So the answer is B, aqueous deficient dry eye. So all of these are symptoms and signs of aqueous deficiency, and when associated with a reduced tear meniscus height, it's quite clear that the answer is aqueous deficiency. Let's move on to the next question. So, which of the following best describes the mechanism of action of lippy flow in treating meibomian gland dysfunction? Your options are A, suction removes inflammatory debris from the tear film. B, pulsed heat liquefies meibomian secretions while simultaneous pressure clears the glands. C, topical thermal therapy stimulates lacrimal gland secretion. Or D, intense pulsed light coagulates abnormal eyelid vessels. Your time starts now. The answer is B, pulsed heat along with simultaneous pressure. So the lippy flow gives pressure from the external aspect of the eyelid, heat from the internal aspect of the eyelids, and therefore is effective. So I think that's all from me, right? Thank you so much.
Great. Thank you, Dr. Tushar, for wonderfully taking us through this MCQ round. And all the quiz master, Dr. Deepti and Aparna, it was quite an interesting and a learning experience for all of us here too. So, postgraduates, we are almost at the conclusion of today's first preliminary rounds of first quarterfinal round of season 5. And we will be only announcing the results of the private practitioner categories or people who have played into it besides the team results. The team results will be declared at the conclusion of all quarter-final rounds and who will be making. So keep your fingers crossed till then. So let us have a small chat with the people from the private practitioner category. Sai, are we ready with the private practitioner category prizes? The top
Yes,
three? Top 10 people? Top 5. Can I have request all the quiz masters to join us get their video audio as well on now? We'll have a small chat with the and if any mentors who have logged in, please raise your hand. That will help us in having you over the program. We will also like to chat with the mentors who create such a beautiful teams, such intelligent teams, how they mentor them. We like to understand from them, because every time we see few of the institutes repeatedly having their teams always reaching into the quarterfinals and the semifinals as well. So we need to understand from them the secret of successes, how they groom their own students from their colleges. That will be helpful to other teams as well. So can I request some of the team mentors to join us, please? Just raise your hand, we will upgrade you. Dr. Deepti, Dr. Aparna, can you just log in?
Yes, it's on.
Yeah,
Video
yeah,
and audio is on.
please do.
Yes.
Please do. So we are waiting for the final results of the private practitioner category till then. Anyone in the chat box, what are we saying? Yeah. So we have, so these are the people who in the private practitioner category who have played besides the team. And these are the prize winner, top 5 people. Phone number 8860815899. 9315099559, 964555333726, 9061031036, and 9769300455. Please raise your hand so that the backend team will upgrade you and will make you the participant. We would like to have a chat with these people who have made it into the from the private practitioner category. And
Dr. Pandit.
Hmm?
Dr.
Yeah, Dr. Aparna, I don't see you here. Have you logged out?
I'm there, sir.
Please get your video on.
Some issue with my video, so I.
Okay, no issues. No issues. Sai, can we upgrade them as a panelist, please?
Already done, doctor, two of them.
Okay.
Good evening, sir.
Supreme Goyal. Okay, okay. So,
Yes, sir.
Supreme,
Yeah.
thank you once again
Yeah.
for being a regular participant in our quiz. Dr. Supreme, just for the sake of audience, can you introduce yourself? Hello? Hello?
Hello, are we connected?
Yeah, you are connected. Please do introduce yourself.
Yeah, I'm Dr. Supreme Goyal. I'm currently doing VR fellowship from Chaitanya Eye Hospital and Research Institute, Trivandrum.
Okay, with Unni.
Yeah, with Uni, sir.
Okay. How come you got into this business of quizzing? Is it just the quest for money, or is it the quest for something beyond money?
Sir, it
Or the
started from
price
the
of-
post-graduation actually, where we begged third prize. And at the same time, our RIO PJMS Rohtak also got the first as well as third in the same same
I do
session.
remember. I do remember that. So Dr. Deepti and Dr. Tushar, Dr. Aparna, this girl has been with us as a postgraduate. Now she's into private practitioner category. You can have a small chat with such wizards like this.
Oh,
Dr.
I think
Deepti.
it's really amazing. All right. I love your
Ma'am,
name.
it's very
And you like
thank
are
you so much,
actually
sir.
kind of making it to, let's say, like supreme levels in quizzing and continuing your passion. I think you're an
I
inspiration.
love quizzing, ma'am, though it is very difficult nowadays now that I have joined fellowship. So it is actually very difficult. I just ran from there and like as soon as it finished, I just ran fast and joined it.
Amazing. You're an inspiration.
You're a
Good.
Thank you
serial
so much,
winner.
ma'am.
Yeah, it's really great to know you.
Thank you. Thank you, Dr. Supreme. Do follow us and do keep participating and also encourage other postgraduates
Tushar
who are
sir
in
put a lot of cornea questions. I was actually worried whether I will be able to answer them now that I am a retina fellow.
Great. So I did scare you a little bit. I'm glad.
Yeah, definitely, sir.
So we have another habitual offender, rather Dr. Parth again, who has been following our quiz. Rather, he was during his post graduation at LVP and now as a fellow at Coimbatore. He's still with us. So Parth, your
Yes, sir.
experience. Tushar, he's again a cornea guy. Tushar, can you quiz him now? Beyond
So maybe
It
ophthalmology.
you
was
got
actually the
some.
other way for me. It was great to have cornea questions today. I think that's why I got got into the private practitioners category, sir.
So maybe I gave some advantage to people who are cornea trained
Yeah,
or cornea training because there were a lot of cornea questions. So maybe I
exactly,
should
sir.
balance my questions a little more between specialties. Then.
Parth, one more question. Last question to you this time. You're recently married. How do you spare your time between wife and a quiz? New wife and a quiz.
Yeah, sir, it's difficult, but it's okay. Anything for a quiz.
Okay. So congratulations, Parth. Keep
Thank
playing,
you,
keep
sir.
motivating other people as well. And best of
Sure.
luck for your future career as well. And we would love to
Thank
see
you.
you being a part of our, okay, Big Q and Brain Teasers as well. Best of
Thank
luck.
you. Thank you.
Sai, anyone others have logged in? Sai?
No, doctor.
Okay. So I think we had a great first quarter final. So it's time
1 minute.
for
I
us to,
think we have one more, doctor.
yeah, can we have him? Name him? Just
Anad.
get your video on, please. Read out the number.
I've just promoted.
Yeah. Just get your video on. Yeah, Dr. Anandan. Hi, ma'am. Good evening and welcome. congratulations on being into the top 5 private practitioner category. Congratulations. Dr. Dipti, you can quiz her a bit. Yeah,
Dr. Ananda, tell us about yourself. Na? It will be nice to know.
Yes.
Sir, I'm currently doing my cornea fellowship at Aravind Coimbatore.
Dr. Tushar.
Yeah.
So that is the cornea advantage, huh?
Nice to see so many cornea people though. So that's great.
Nice, Dr. Nambiar, and all the very best to you.
Thank you.
How come you are into quizzing now, Ananda?
Actually, I like to take part in quizzes during my PG period itself, but due to the COVID times and all, I couldn't get much chances. So that's why.
Great.
Nice.
So nice. It's so nice that in spite of having completed your education as a postgraduate, now pursuing your fellowship into cornea, you are still into it and finding time for our quizzes. That speaks a lot. Rather, it is definitely fattening and encouraging for a team of brain teasers. And we love
Thank
to
you.
have audiences like you and people who are participating, which encourages us to do more and come out with more seasons in the future as well. Thank you, Ananda, for
Thank you,
that.
sir. Thank you.
Thank you. So, friends, it's time for us to wrap up that today's first quarterfinal. The next quarterfinal, that is the second quarterfinal, would be on the coming Wednesday, and that is going to be the
1st of April.
1st of April. Remember, it's a fool's day, but we are not fooling you. For sure, we are going to have a second quarterfinal on that particular day. So the teams, next 21 teams, which we have already shared with you in the various WhatsApp group as well, you are aware who are going to play on that second quarterfinal. Besides that, the other people who could not make it into second quarterfinal or are into other can continue playing in the private practitioner category. So thank you for all the postgraduates. Thank you, mentors, for encouraging and creating such wonderful teams who really compete so hard with us in the during this competition, during this brain teaser big Q quarterfinals, as well as throughout the season. And last but not the least, my sincere most thanks to all the quiz masters for making this experience such a wonderful and as well as educative in nature. Dr. Tushar, Dr. Aparna, and Dr. Dipti. It was really fabulous having you all again, and we look forward to your continued support in the following seasons as well. And of course, last but not the least, my sincere most thanks to His Highness team for being a steady financial partner with us. So now it's time to say goodbye from our end. We will be meeting on 1st April again at 7:30 p.m. with second quarter finals. Till then, bye-bye from our team. Thank you. Thank you, everyone.
Thank you.
Thank you.
Thank you,
All the
sir.
best, yes. Thank you. Bye.
Thank you, ma'am.
All the best, everyone.
Thank you so much.